Saving someone else's life is one of the most noble acts someone can do in their lifetime. And one way to do that is registering to become an organ donor. With us today, we have Dr. Ahmed bin Saeed al-Busaidi, who is the head of the organ transplantation program here in the Sultanate of Oman. So thank you so much for joining us, Dr. Ahmed. It's a pleasure to have you.
Bismillah ar-Rahman ar-Rahim. Thank you, Brother Talal, for inviting me and giving me the opportunity to speak through Oman Radio English channel. Giving a little bit about history of organ donation and transplantation in Oman. The first kidney transplantation in Oman was done on October 1988. It was from a living donor. In the same year, in 19th of December, the first kidney transplantation was done from a deceased donor. For that, we have marked this time as Oman Organ Donation Day, and we celebrate every year during 19th of December about organ donation and motivate the community to go forward for organ donation. Internationally, there is no consensus about having International Organ Donation Day. For that, we have brought this idea of having our own National Organ Donation Day. And 2 years back, we have the first celebration with the presence of His Excellency, the Minister of Health and the Minister of Religious Affairs and His Eminence Sheikh Dr. Kahlan during that time. And during the first celebration, we launched a national campaign for organ donation. And Alhamdulillah, now more people are coming forward for organ donation. Now, also in 2017, Oman started the liver transplantation program that is also going on. And 2 years back, we have launched the app also for the people to sign up as an organ donor. And since the last 2 years, alhamdulillah, the program being very active, number are going up in terms of organ donation and transplantation.
Inshallah. You mentioned the Minister of Endowment and Religious Affairs and Sheikh Dr. Kahlan al-Kharasi, the Assistant Grand Mufti of the Sultanate of Oman, being part of this. So since we're on that topic, I'd like to ask you, what is the view of Islamic scholars when it comes to organ donation?
His Eminence Sheikh Dr. Kahlan was very supportive for the program. In 2016, we had the number 6 National Bioethics Forum at the Sultan Qaboos University, where we discussed about the organ donation, and himself, he also contributed to that forum, expressing the importance of organ donation in saving life. And in addition to that, he also was with us during the launch of the national campaign, and also he gave a talk. In addition to that, also he has also his own episode on Su'al Ahl al-Dhikr about the importance of organ donation. So in terms of religious, I think it's very clear for people now that Islam do encourage people to go for organ donation as a form of saving the life, because it is really save the life of people who are not having an organ donor.
Very well. So what are the most important organs usually that are needed here in the Sultanate of Oman, out of curiosity?
The most important organ is the kidney here in Oman and also worldwide, simply because there are so many life-related diseases that can affect directly the kidney. The first two that cause a kidney failure is uncontrolled diabetes and uncontrolled hypertension. And also we use this opportunity also to educate people not about organ donation, but also keeping healthy organs for them, because we don't want people to need to get the organs. For that, we know that diabetes and hypertension is the most common causes of leading to kidney failure. Maintaining good lifestyle, going for exercise, avoiding junk food, I think very, very, very crucial element in maintaining your organs. Also, people who have diabetes or hypertension, they should also follow the instruction of their treating physician in terms of making the blood pressure and blood sugar under control. Otherwise, these two diseases affect directly the kidneys. For that, we have very large number of people of having diabetes, hypertension, getting kidney failure, requiring dialysis if their diabetes or hypertension is not well controlled.
Very well. What are the methods that you use when you find a patient or a deceased person who is able to donate an organ? How do you reach the conclusion that this organ from this person is suitable to be transplanted in someone else?
So organs are only can be taken from human. Unfortunately, until now, we don't have artificial organs. So a living person can donate one of his kidney or part of his liver to save the life of two people. A deceased donor or people who die and they donate their organs, they can save the life of 8 people and improve the life of 50 people. Now, the major organs that can be transplanted after death is the heart, lung for 2 people, liver for 2 people, kidney for 2 people, and also pancreas. This is that will directly save the life. Also, people, they also can donate the tissue, especially the cornea. Cornea also can give the sight to people who are blind. The skin also can be donated. A bowel also can be donated. So many tissues in the body that can help other people, like people who suffer from severe burn, they can also get transplanted by skin. Bone also can be transplanted. So this is in general the importance of how people they can save the life and improve the life of other people if they donate their organs during life. Unfortunately, or fortunately or unfortunately, it's only the 2 organs that can be donated: one kidney and part of the liver. So in terms of living donors, according to the bylaw in Oman, that any person who has a relationship with the patient up to 4th degree can donate directly during his life, either by one of the kidney or part of the liver. They go directly to the transplant center. We have 2 transplant centers in Oman, the Royal Hospital, where kidney and liver is done, and the Sultan Qaboos University Hospital, where kidney is done. So they go directly there in the donor clinic there. They get assessed, and it's a rigorous assessment for the donor, because the idea is to help patient, not to make another patient. So for that, people who are donors, sometimes they get frustrated or they get bored. Why you are doing this so many investigations? Why are you getting? It's only for their own safety, because safety of the donor is like a red line for us. For that, no donor will be cleared to be donor unless he is totally fit, he is healthy. Donation will not affect his life and he will go back to normal. For that, so many investigation will be done for the donor before clearing him. So now, then during that time also there is a process of psychological assessment. His mentality is okay, he's capable of taking decision, because people who are under 18 or has any mental issue that cannot consent to be an organ donor, they are also not allowed. So somebody who is above 18 and who is mentally competent and will be assessed also psychologically, socially, and medically. And if they are cleared, then they will go for the process of organ donation and transplantation. And also the donor has the right also to revoke the consent at any time as part of his right of organ donation. So this is in terms of living donor who has a relationship. So 4th degree cousin also can also donate, brother, sister, father, and according to the bylaw in Oman, who is up to the 4th degree. Now, if somebody is beyond 4th degree, also they can donate. However, they have to be interviewed by an ethical committee at the Ministry of Health headquarters in order to be cleared, because the donor has to have a relationship with the patient. Either that relationship is like a blood relationship or a genetic relationship or emotional relationship. So what do we mean by emotional relationship? If somebody, let's say co-worker, They are not related, but said we work together for 20 years. He's my friend. Now I get to know he needs a kidney. I come forward. I have no family relationship with him, but willingly I want to come and donate for him. So these such donor, we bring them to Minister of Health. We interview them. We ensure that there is really like an emotional relationship for them, because all this idea is to try to avoid any form of corruption or any form of financial exchange for organ, because as you know, organ trafficking or commercial transplantation or any monetary against donating an organ is illegal, it is unethical, and also it's forbidden in Islam.
How long does this investigation usually take before you confirm that this person will be donating, this living person will be donating to the patient?
Usually the health system, people, our colleagues in the hospital, they will try to make it as soon as possible, because we don't want to delay the donor. So it depends like in the appointment system, because it will be done like as a routine. So he will get like appointment in different section, like for example, for ultrasound. They will do also a sort of blood investigation. For example, kidney, they will do a sort of urine also investigation, making sure that the kidney is working, both kidneys are working well. For liver also, they will do certain scans. So it depends on the appointment system, but roughly usually it take maybe 2 to 3 months, sometimes 4 months. It depends on the also the case also of the donor, if he has any issue that need to be further investigated. However, we are trying to make it as short as possible.
Dr. Ahmed, we've now covered living donors. What are the criteria for deceased donors?
Donation after death or deceased donation is one of the like approach that worldwide approved since maybe around 1950 because of this. As you know, internationally we have a shortage of organs, and it is estimated that only less than 10% who required organs, they will get it because of the international shortage. So in 1950-60, where the ventilator has been invented, health system noticed that there are people who come to treatment, like for example, road traffic accident, they put on ventilator, and later on they found that they are brain dead, but their heart's still working, their lung organs are still working, but they are brain dead. So brain does not function by all criteria, and the heart is beating because of the ventilator and because of the medication. So here comes the idea of the brain death and donation after the brain death, and also it starts the era of heart and lung transplantation, because heart and lung cannot be donated during life, it's only during death, and it has to be brain death because you need still blood to circulate it before taking the organs. So people who actually get diagnosed as brain dead, they kept on certain protocol that they will be given medication that will maintain their blood pressure, that their hemodynamically will be stable, so their kidney, liver, and other organs can be maintained with blood, not because the person is alive, but because he's a potential donor. He's a potential organ donor. So what we have here now, we have a protocol that confirm brain death. The protocol is very strict. The brain death has to be diagnosed by 2 consultants, and the brain death examination has to be done twice. So if somebody diagnosed with brain death and confirmed, the ICU doctor will inform the family that their loved one now is brain dead, and this is the point where there is no return, the blood is not going to the brain, and his heart is beating because of the medications that is given at the beginning, because of there was initially some hope that he can recover, but now there is no hope and only given the medication just if he can be an organ donor. So the family will be counseled about this situation, and they will be given the option they would like to go for organ donation or not. But they will not be discussed by the ICU doctor usually, the organ donation, the concept in details, because they are the caregiver. So once there is a brain death, family get approached. We also get informed as National Organ Transplantation Program, where we go and we approach the family and we explain to them again about the situation, and we ask them if they are willing to sign for organ donation. So in addition to that, we have also the app, the MOH app, where people they can express their will to be an organ donor after this. So the app is open for all, for Omani and also for resident. It's very simple. It takes maybe 2 to 3 minutes to fill the form, and the information are very confidential. It comes only to the ministry headquarters, the National Transplantation Program. It is only limited for now 2 staff in the National Transplantation Program that they can access this data. So once we get a confirmation of brain death, we see whether the person is an organ donor or not. Does he expressed his will? And the expression of his will could be yes or no. So if we notice that he expressed that no, then we will not approach the family, because we respect that wish. Then if he also expressed that yes, we approach the family, we inform them that he expressed his wish as an organ donor through the app, if they would like to consent or not. If somebody also he didn't express, we also he didn't use the app, we also approach the family and we try to figure out like what was his opinion. Maybe he does not know about the app, but some people they will say, yeah, we have discussed, we heard in the news, he said I wish I can be an organ donor, for example. So we will get the sense of the family, what was his wish. Was he like very generous people, like he would like to help other? So do you think if he get the option back will be also will consent or not? So this is the sort of discussion with the family. So if the family agreed that they will go for organ donation, then we'll take the consent, and then we will investigate the organs, are they are valid for transplantation or not. Sort of panels of workups, bloods and radiological investigations, just to make sure that the organs are healthy and also can be transplanted to the patient. Then there we have different committees that decide about this for each organ. Like we have a committee for the kidney, we have a committee for the liver, we have a committee for the heart, for the lung, and they will decide, yeah, we agree the kidney is healthy, this can be given to somebody who has no donor. So if the committee agreed that the kidney, for example, can be taken, then we will see who is in the waiting list, because there are people who are on the waiting list requiring these organs, and this waiting list is have a scoring system where people, how they get the priority, and we will see. And this priority scoring, it's only depends on the health condition of the patients. There is no other parameters that include in the scoring system except the health condition, who require urgently these organs. So we'll see who is there who require urgent these organs, and the committee also will decide about this. Then we will do the matching. If they also match, then the decision will be taken that this organ will go to so and so, and then a time will be set for retrieval of the organs and transplantation.
So to our listeners, you can download the app Shifa, that is SHIFA, again, SHIFA, on Google Play Store and the App Store if you wish to register as a donor, or if you wish to not give consent to be a donor as well. Now, Dr. Ahmed, let's talk about the actual cases. Let's look over the last year. How many donors have there been, either deceased or living?
So the program has been progressed in the last 2-3 years because of several intervention. Of course, one of them is the direct supervision and direction from His Excellency the Minister, Dr. Hilal Al-Sabti. So in 2015, 2021, the National Transplantation Program has been elevated and has established its office in Ministry Headquarters. And also a dedicated department later on was established for organ donation and transplantation that report directly to His Excellency Dr. Said Lemki, the Undersecretary for Health Affairs. And also now there are dedicated staff that are there in the National Transplantation Program that only their duty is to facilitate, to follow up issue related to organ donation and transplantation, and also to have this family approach of the brain death, because this was not there in the past. However, in the past there were some cases where also deceased donor they came, but that went to the family initiative where they come forward to healthcare providers and ask them for organ donation. But the new system now we have introduced, we approach the family. For that we have increased the number of people who actually signed for or give consent for organ donation. So other things also, support being given to like human resources at different levels and the Ministry of Health. So in 2023 we have approached, in terms of disease donation, we have approached 11 families, and we get a consent from 3, and 4 kidneys has been transplanted, and the first liver from deceased donor. It was on May last year, the first deceased donor liver transplantation. And liver is, I feel, is more touching, because people who have kidney failure, they go for dialysis. But for liver, if we don't have a donor, unfortunately, there's no option except liver transplantation. There is no dialysis for liver. For that, this person who got liver last year, he was like, we made one video in the YouTube about his scenario, because if you don't have a donor and somebody who is having liver failure, that means he cannot survive without a donor. So when he get the news that there is a disease donor, he said, now it's a new chance of life. But kidney, they go for dialysis. Although dialysis, we consider it as a bridge. The same thing happened with the heart and lung. So heart and lung, and also liver without living donor, there is no option except organ transplantation. So in 2024, we have approached now around 32 families for disease donation, and 5 they have given the consent, as you can see in the news. And we transplanted 10 kidneys and 2 livers. We hope, inshallah, more people, they will sign up as an organ donors. In terms of sign up, there are 2 approaches internationally. As you know, there is opt-in system and opt-out system. The opt-in, where people, they go and sign up as a donor to be a donor, and the opt-out, it is the opposite. They go and sign on not to be an organ donor. So everybody reach certain age, they considered an organ donor unless they go and sign as to opt out. So we have like adopted like both of them, that to be very transparent, to give people the options, because it is a donation, and donation you must be given willingly, and we have given people the both options. It is up to them whether they would like to get this chance, because when we approach the family, we don't ask them for organ donation. We give them the option of organ donation as one of the good option at the end of life care, because once the tube is removed or the heart gets stopped, then this organ will dissolve. They will put in the grave and they will dissolve, and they are very precious organs. There's no money that can buy the heart or lung or kidney or liver. For that, we tell people, if you sign up or if you give a consent for your loved one to be an organ donor, that means you are giving a life for other people. And we have shown like how children get a new life when they get a donor if they don't have a living donor.
Very well. Speaking of money, let's talk about commercial transplantation. What would you say to anyone who is considering going internationally for commercial transplantation?
Organ shortage is everywhere. People, they will try to get the organs by different ways. Unfortunately, some people, they will get weak and they will try to go for the commercial transplantation, which is illegal, unethical, and also forbidden in Islam. So commercial transplantation, usually in countries where the law is weak, the poverty is high, and the brokers of organ trafficking, they are very active. So they will get people who have money, and also they will try to lure poor people to get their organs taken. So these gangs, they don't follow any international ethics. These transplantation are not done at professional healthcare facilities. We have patients who reported that like it is done in farms, in apartments, in kitchen. So and many people either they die there, or when they come back, they come with so many complications where the kidney or the organ has to be removed. So mainly this one is kidney, because other organs, liver also some cases, but other is extremely difficult to be done in a professional way. But kidneys are one of the most people that are going for commercial transplantation. We educate people, a part of our campaign to educate people not to go for such thing. It's very serious, it's very risky, and also it's very unethical. Even if you go, I ask them, even if somebody like get a chance to go for commercial and get a kidney which is functioning, I don't consider it as a success, because I don't know from where that kidney is taken. It could be from a kidnapped child. I don't want to get a kidney from a kidnapped child. Okay, for that it's a failure. It's a forbidden. It is unethical, and it is run by organ trafficking brokers, and it has so many complications. And we advise people to find a donor from their family members or friends, or if they don't have, just to wait from a disease donation program that will also invite people to go and sign up and also consent once they are approached.
Have you dealt with any cases of people who have come back and have used commercial donations and failed ones at that? Have you dealt with them here in Oman?
Yeah, unfortunately, people, they go by their own. We don't advise them. We educate them not to go. However, sometimes people, they do go there, and they come with so many complications. Not only that, people get also tricked that the kidney has been transplanted, but when they came here, there was no kidney.
Wow.
Yeah, their money was taken, and there was no kidney. Only incision was made in their abdomen, and unfortunately there was no any kidney. So yeah, so it's organ trafficking, that it is forbidden by all means.
How much money does it usually cost in situations like this? How much money are people losing when they go for options like that?
Yeah, it is in thousands, and some people, because we don't involve, but people who go there, they said they pay, some of them they pay 15,000, some they pay 20,000, and according to some reports, these poor people, they don't get anything, almost like only few reals or few dollars they get there, because most of this money they go for the brokers from different parties. And also there are some report where these villages get completely vanish, because brokers, they take these kidneys from youngster, and some of them, they tell them that the kidney will regrow, which is wrong, and some of them, they will tell them also it is okay to have one kidney, and when they go back to their villages, they don't get care, and they die. So when they die, they don't marry. The youngsters don't marry because they saw their kidney complication for this. Some villages even get completely vanished because of this in these poor countries. For that, it's a black market. It's a black area. We don't advise anybody to go for that area.
Well, that's very saddening. Dr. Ahmed, a lot of people, they watch movies, they see, police, let's say, in an American movie saying, oh, they're an organ donor, we have to get them very quickly to the hospital. Is there an actual way here in Oman where, let's say, if someone is in a car accident, is there a way for the ROP or the Ministry of Health to immediately identify them as organ donors?
Now, disease donation can be mainly after brain death, but after the heart stop, the blood get clot, and extremely difficult to get an organs if the blood get clot, except with tissue and cornea. It can be retrieved even within 24 hours, but for organs it has to be in very short time. So like having organ after heart stop, as we see in the movie, it's very extremely difficult. The system has to be done very extremely quickly within let's say within 1 hour, which is very difficult. However, if somebody whose still heart is beating and rushed to the hospital, they will be resuscitated there. The heart will be restored, and then they will see if he's still the brain functioning or not. If brain is not functioning, then that time the organ can be taken. So yeah, it's maybe in the movies, but in the actual practice, it's mainly after brain death most of the countries.
Our producer Azam Raisi had a question off air where he asked if they realize at the hospital that somebody is an organ donor, would there be chances where they're like, you know what, we don't have to work too hard to save this person, as they can donate their organs to many people? What's your response to that, Dr. Ahmed?
Thank you. Very interesting questions. First of all, we trust our healthcare providers. We go to them for medical check. We go for them for routine surgeries. So we trust them during our life, first of all. So they are very professional. They are very trustful. The second thing, this information, who is the organ donors, it's very confidential. It does not reach to the hospital, does not reach anywhere. It reach only to the National Transplantation Program, where two only people have the right now. Myself and my assistants has the right to access this data and to see this person is organ donor or not. And we don't access this data unless we get a brain death notification from the hospital that this is a brain death. Then we access data. We will see, is he an organ donor or not? If he's an organ donor, then we go and we approach the family. We tell them, we print the will. It's a form of will, and it's very simple. Even they can sign on their mobile phone, and also they can choose what organs they would like to donate. We have listed the all organs, and also there is also people who are make it very formal. Also, there is a witness if they would like to inform a witness. But we have included there mandatory is somebody in the family who is aware about your organ donation, because sometimes we approach the family, so we don't know whether we don't know about what he signed or not, so they get confused. So for that, we tell people, if you sign up, then you need to mention whom you have informed. Some people, they say, okay, I informed my wife, my brother, and so on. So when we go and approach the family, we said, okay, according to the information in our data here, that he informed so and so about this will. However, we encourage people to speak during the family gathering. It's very important. Let's forget the app, let's forget anything. If somebody who is expressed his will in front of 10, 15 people, what do you want more than that? He said, okay, after death, I want to be an organ donor in a family gathering, whatever. So this is, I think, the most important part. If you would like to sign up, that will be good and fine. But let's speak in our family gathering, express our will, whether I want to end this life with saving another life or not.
What about if there's a divide in the family? Let's say the father and mother agree, but the wife does not agree, or the brothers agree and the sisters don't agree, or vice versa. What do you do in that situation?
So when we approach the family, we explain to them everything about the organ donation and how they can save the life and about the situation. Then we will give them time to discuss in the family. And then if they come back with a conclusion that everybody is a consensus, that everybody is agreed, then we ask the next of kin to sign. And it is up to next of kin whether to take that controversy significant or not. We will take, according to the bylaw, we will take the consent from him. But usually the next of kin will not sign if people are not all of them agreed, especially like senior family member and so on. And also we don't want like that sort of conflict in the family. We want everybody to be happy, to be comfortable. We'll try to discuss why he is not willing. Is it because of religious? Maybe you can ask him to go and ask religious people. Is it because of his belief, because he see that the heart is beating? I don't believe this brain death. Then we ask our colleague in the ICU to explain to him that this is the heart is beating because of the medication and the ventilator. So we'll see why the part of the family member they are refusing. But at the end of the day, they have the all right to refuse. And we don't force anybody for, as I told you, we don't ask them for organ donation. We give them the option of organ donation.
Dr. Ahmed, do you have any message out there for our listeners or viewers right now, Omani or foreign residents here in the country who are tuned in?
My first message for them first is also to keep their self healthy, keep their organs healthy, have a healthy lifestyle. And because this one will keep your organs working for a long time until a long life, inshallah. And also, if you keep yourself healthy and your organs healthy, your chance of giving the life of other people, either during life or after this, will be high. So my first message for people is to keep yourself healthy, keep your organ healthy, have a healthy lifestyle, healthy food, exercise. And if case you get any chronic disease, take care about it, especially hypertension, diabetes, take your medications, make sure your blood pressure, blood sugar, if you have diabetes, and controlled, so your organs won't be affected. My second message is for people who get who get organ failures and need organs. Don't go for commercial transplantation. It's very dark sides. It's very risky, and it is unethical and illegal and forbidden. Try to find a donor from your family member or from friends, colleagues. And for people also who are healthy, I would like also to ask them if they have a loved one in the family and they need a kidney or part of the liver, also to go forward and save his or her life by giving that organs. And also I will ask everybody also to sign up as an organ donors in the Shifa app. It's very simple, very confidential. It's a good chance for people to have a final charity that will save the life of 8 people and improve the life of 50 people. And to sign up in the organ donation app.
Very well. So that again is the Shifa app, spelled SHIFA, which is available on Google Play Store and the App Store, and also offers many services from the Ministry of Health, not just organ donation. And we urge our listeners to register to sign up to this. It only will take you about 2 to 3 minutes. And again, it's Shifa app, SHIFA.
Speak with the family also. Speak with the family about your will. It's extremely important. It will give them ease to take a decision later on. He said, okay, he expressed his will. I think we have no right to object. This was his will. So, expressing the will give the ease for family later on for the consent.
Thank you so much, Dr. Ahmed, for joining us today and for giving us all this precious knowledge. We really appreciate your time.
Thank you, Brother Talal, for giving me the opportunity to speak to people, and I hope we can also have another episode.
Inshallah.